So today we're going to have a conversation on behavioral health and the impact on America's workforce. My name is Kelly Williams, and I have the honor of serving as a Chief Human Resources Officer for Blue Cross Blue Shield Association. And as part of my role, I get the opportunity to work with amazing individuals like you're going to meet today. Two key areas we're going to focus on: caregiving and burnout. So with that, let me introduce. Today we have Dr. James Polo, the Executive Medical Director of Regents Blue Cross Blue Shield and an experienced psychiatrist. We also have Dylan Landers Nelson, Director at Business Group of Health, advising large employer benefit teams on innovative ways to drive health outcomes. And Alexandra Drain, CEO of Archangels, a national movement and platform recognizing, honoring, and supporting caregivers. So let's start with the first question. I would love if you guys would maybe take a little bit of a deep dive into, mental health particularly, right? So one is mental health, definition of a mental health, what it means, and then burnout.
The easiest way to understand burnout is it's like exhaustion, total exhaustion, physical exhaustion, mental exhaustion, emotional exhaustion. You reach burnout when you just can't bounce back to your normal ability to handle what's going on around you. And that's what can lead to kind of more severe mental health problems.
It really doesn't matter where you are on the spectrum. It doesn't matter from an age perspective. We know that there are at-risk populations that are feeling it even more intensely, and we have to help them first. But if you're present right now, paying attention to what we're saying, most likely you have burnout.
For the purposes of our discussion, I think the burnout we're talking about specifically is that chronic stress that is caused by issues in the workplace. But of course, there are so many other stressors that are present right now that it's all compounding, right? There isn't that release valve that we would all appreciate in normal times to be able to, again, get out and take care of ourselves. And then there's just the additional burden of worrying about the pandemic and your health and your family's health. And then changes in the workplace, changes in your work relationships are creating additional stressors. So it's just all of these things together, to echo my colleagues here, are creating this tremendous amount of stress that over time gets us to a point where we feel burned out. And it was a challenge before the pandemic, and it's just that much greater right now.
So with that in mind, let's take a deeper dive into the notion of, from an employer perspective, signs that your workforce needs some additional support. How do you recognize it? How does it show up? What does the tension look like? And specifically, recommendations that you would have for employers.
Yeah, so I think some of those signs are going to be absenteeism. Presenteeism can be a little bit difficult to measure in some ways, but certainly, seeing someone's, workload or work product tailing off, you're going to be able to see some of those, metrics within the workplace. Of course, we don't want individual, claims being shared back to employers, revealing personal mental health issues, but certainly from an aggregate perspective, you can see that in your data potentially if you've got an increased burden of mental health service utilization, or a number of Navigator programs now can measure if people are seeking that care in the first place.
Yeah, I think that Dylan is pointing out something that's really important. If you're waiting for productivity to go down to do something for your workforce, it's already too late. When folks are really under stress, they start to almost go into survival mode. And so they start focusing on themselves and what they need to do just to get through. So the culture breaks down, morale goes down, the sense of being a team begins to fall apart. And those are those early signs that an employer can really focus on to know that it's time to do something to help everybody.
I think also taking the word productivity and looking at how behavioral health impacts it will help employers make decisions to invest in behavioral health and break down what about my life in this pandemic, regardless of where I fall on any spectrum, is impacted, and where can you help? So, how can you help with childcare, adult care, groceries, legal advice, financial advice? So many organizations have resources that they've already invested in to support an individual as life gets more and more insane, so that they can keep doing well at their job. And most people want to do really well at their job, right? A huge percentage of individuals are very motivated by being of service. And so understanding the behavioral health impact on productivity, investing on helping to positively impact that by looking first at the resources that you've probably already invested in that are there to help with basic chores, but then as importantly, just changing that culture.
I think a lot of this comes back to training of your management at all levels to lead empathetically, frankly, understand where people are coming from and treat them how they want to be treated more than anything.
Ironically, I think one of the ways to look at this is actually getting away from the word productivity. We tend to think of productivity as everything that kind of contributes to that business model so that we can make profit. And the reality is most companies have a mission. So the way I look at it is, if our most valuable resources are people, then taking care of our people allows them to take care of the mission.
And so doing this stuff well from an employer perspective for your employees is huge. I also think we have this thing we call look, love, lift. Wherever you are, look around you. There are caregivers everywhere, and they don't look like what you would expect. Take a second to love on them for what they're doing, and then give them a lift. And that lift can be saying, I see you, you're not alone. It can be connecting to someone to resources. It can be filling their their fridge. And I think, thinking hard about the ways that we can be supporting a population that might not look like what we expect. A lot of unpaid caregivers, 1 in 4 are millennial, 1 in 5 are Gen Z. A full 66% of the US right now, if you say, are you worrying about or caring for the health of a family member, neighbor, or friend, they're going to say yes. The other thing I'll just share, because it hits so close to home right now, and I'll be careful not to get super emotional telling this, my mother-in-law died a week ago Tuesday. And she, in the end, she did not die of COVID, but everything about the experience was impacted. Obviously, we were really lucky that she was able to die at home. And we know that so many people right now have loved ones who have not been able to die at home. And they've died isolated. And the long-term grief and despair and guilt that puts on those unpaid caregivers is profound and immeasurable. And I think we're only beginning to know what that impact's going to be. And one of my loved ones came from college and had tested negative twice, ended up feeling badly the next day. We thought she was just grieving, as we all were. Tested positive the day after that. And I am talking to you guys right now from a quarantined household with my 16-year-old daughter then got it, and she is in isolation. And I can only tell you, in a very privileged world where we have the luxury of being able to be in separate bedrooms, what it's like to be mourning and isolating at the same time. And we only lost one person to a beautiful death. There's so many folks who've lost multiple people. So I just can't say enough. The country is a really, really, really hard time, and I don't see it getting better anytime soon.
How can we, as employers, as managers, as leaders, as colleagues, support, provide solutions? What does that look like and feel like?
We see a number of our employer members who are doing more manager training to have people both kind of in the corporate level, but frontline managers understand issues related to mental health and kind of be able to be more informed and on the lookout if they might have a colleague who could benefit from services. There are certainly ways that you can have those conversations that are far less stigmatizing than they may have done in the past. And certainly, one of the strategies that employers can use is have your senior leaders talk about mental health and caregiving, stress, burnout. We still see some hesitancy there. I think people who are kind of at the top of the food chain and major corporations are used to being successful, confident, projecting strength. But we see a number of employers who have done well in increasing utilization of services to support caregivers, to connect people to mental health resources when they have leaders who are willing to talk about things that are impacting them and their lives and their work.
I think employers can play a huge role in helping to educate their workers, because sometimes employees don't really know what it is that they need, or they don't know if they can talk about getting help, or they don't know if what they're doing is actually even helping them or affecting them. And so employers can play a huge role in, first of all, helping folks recognize and identify those things that are creating or leading to burnout, and then making sure that they've got the right services available, whether it's self-help and dealing with stress, or whether it's getting help from somebody else.
There's a lot of data that exists and that we've seen in the work that we're doing that looks at the value of just knowing that support exists. So if you know that there is somebody you can turn to, right? Like your personal red phone, somebody, a coworker, for example, and share what's going on, whatever that might be. There's a 40% reduction in depression and a 30% reduction in anxiety. If you know that respite programs exist, even if you don't access them, it's a 70% reduction in stress.
In general, conversation does change culture. So what I'm hearing here from an organizational standpoint is the ability to be in a conversation, having this conversation be front and center, working with our managers in particular to be able to have language, to be able to read cues even through Zoom, right? When somebody may need additional support, to be very thoughtful about our word choices is key as well. And do not underestimate the power of actual listening. So with that, I want to say thank you to this group for the conversation that we've had today. Appreciate all the perspectives, the personal stories that you have shared, and the vulnerability that you've shown, and also the solutions and ideas that you've put forth today. They're critical. Again, mental health is not something that is just now. It has always been. And as we talked about it, it is a opportunity, not a disadvantage, to be able to have it as part of a conversation in an organizational culture where people can show and share and learn and grow from one another. So with that, for more resources, for those that are interested in terms of continuing this dialogue and this conversation, you can reach out to smarterbetterhealthcare.com for additional information. And as always, you can reach out to your health plan partner.